Everyone is talking about it. No one from our industry has addressed it yet. What happens if your hospital requires you to have the COVID-19 vaccination? On this episode, we talk about that. We talk about what we're going to do as a company and how it affects you. Atlas All Access starts now. All right. Compliance Manager Cassie Wolford joins us.
Hello, everybody.
Thanks for joining me again.
Of course.
I wanted you here, one, because you live in compliance every day. And this is just going to be, as we've gone through this year, this is just another step along the way in compliance, right? I can see hospitals just adding this to their compliance regiment before a traveler can start at a hospital, right? So how are we going to deal with this type of thing? So I thought, what better way than to get you in here and let's talk through this.
Yeah, absolutely. It's a fluid situation, so things are changing fast. However, in compliance, if it's required by the facility in their protocol, then Atlas will cover any costs that incur with getting that vaccine.
And if you're on Facebook, which all of us are, there's just ridiculous controversy now about I'm not going to get the vaccine, I am going to get the vaccine, whatever. When it comes to a job, when it comes to taking a contract somewhere, there are hospitals that are giving the vaccine right now to their staff nurses, right, to their floor nurses, that if you have a traveler come in, they're going to require it. If you're not comfortable with that, that's fine. Understand, though, that might stop you from getting a job as a traveler there at that facility.
It absolutely could. If that becomes part of facility protocol, then they can absolutely say we won't accept anybody who won't get the vaccine.
That doesn't have proof of the vaccine.
Absolutely.
Now, there are facilities out there right now, one just down the street from us here in Omaha, who just received their first shipment of vaccines like yesterday. Like it was just a few days ago, that they're giving it all to their staff first. Then they said any ancillary staff. So I would assume any kind of travelers or any other staff that are coming in and out of the facility that might have patient contact could get that vaccine too.
Yep.
That could be travelers.
Absolutely.
So you might have the ability to get it at whatever hospital that you're at right now. If you can, great. Get a copy of, just like you would with the flu shot, right?
Yep.
I don't want to compare this to the flu shot. I know it's different, but it's still a vaccine just like any other vaccine. So let's talk about flu shot for a second.
Okay.
How do you get that? What do you need to get? How does that look? And how would that look if it was the COVID-19 vaccine?
It would be very similar to the flu vaccine, where we would just want documentation of where you got it done at, which arm it was administered in, lot number, injection.
I wonder if and that's interesting. So vaccines are vaccines. And you said lot number. Is it going to look similar to those?
It should, yes, because it all needs to be tracked by the FDA. So
sure,
they'll all have manufacturers and lot numbers.
Gotcha. So I talking to Steve earlier this week about this, because as much as I understand, this is happening faster than we think it's going to. It's going to come up. We haven't had a hospital yet that has said they're going to require it.
Not yet.
I can see that happening within a week or so.
Absolutely. It could be as soon as tomorrow.
Before Christmas.
Yeah.
Right. Arguably, you could have hospital protocol. If you have a January start, you need to have you need to have the vaccination. Proof of the vaccination.
Yes.
Maybe.
Yes.
Like you said in the beginning, it's a very fluid situation. I wanted to talk about it ahead of time, though, because of just that. If you're not comfortable getting that, and I completely understand, if somebody showed up right outside today and said, okay, we have the Pfizer vaccine, here you go. Like, okay, fine. I'm okay with it. I understand the process that goes behind it. I understand why some might not be. However, we're not going to require it if you don't want it. But understand that if you don't, and the hospital does require it, it could cause problems through the compliance process.
Absolutely. We obviously don't want to make anyone do or get anything they're not comfortable with, but we also have to follow facility protocol and what they want to keep their patients and hospitals safe.
And that's exactly why I wanted you to come in here and talk about that, was because it's not something you decided.
Nope.
You got to hold that line, though.
Yes,
right?
Absolutely.
And that's why. So understand, if you find yourself in that process, you find yourself in the compliance process before you start a contract, and Cassie or other compliance specialist from Atlas says you have to have this, it isn't because they're saying it, it's because the facility is saying it.
Yes.
So it's never we are making a stand. We are saying this is what you should do. We're not drawing a line in the sand. We're doing what the hospital says. We're doing what that particular hospital protocol says, and we're going to follow that. As far as I'm concerned, it's hospital by hospital at this point, and I'll be okay with that stance. Now, that could change, but I'll be okay with that stance until it gets to that point. Until every hospital says you have to have it. Like every hospital says you have to have the flu vaccine, right?
Yep.
And then at that point we'll make that decision. But right now, it is what it is.
Yep. It's all up in the air.
But again, nobody else is talking about it, and if we didn't talk about it ahead of time, I would feel like we're doing a disservice to everyone out there. So if you have any questions about it, your compliance specialist would be able to help you here at Atlas. Obviously, if you're in the process and you're working through it, your compliance specialist can help you. Cassie can help you. Kiana can help you. It's not going to get any easier through all of this. However, understand that anytime we ask for something, it's not because we want it. It's because the hospital asked for it, and we're just going to follow what the hospital is asking for.
Yep. And I will, just as a quick note, none of our facilities at this specific time are asking for it. So if your compliance specialist doesn't know or hasn't told you it's needed, then it hasn't been discussed yet. Mm-hmm. So be patient also as we work through all the details.
That's as of December 15th.
Yes.
Like you said, that could change tomorrow, though.
It totally could.
Yeah. So stay tuned. I have a feeling this is not the last time we're going to talk about this. It'll happen more and more and more.
Yes, it will.
So, especially as we go into 2021, it's a part of our everyday lives now, just like the mask is a part of our everyday lives. And
everyday life.
It's how it's going to be. Stay tuned here. If it happens, I want to talk about it right here on Atlas All Access. And I'm going to talk Cassie into coming in here and talking about it with me. So, all right?
All right.
Cassie, thank you so much.
Thank you.
We'll see you next week.